Hey guys, it's Bill, the knee pain guru. Today we're going to talk about advice, suggestions, and tips on self-diagnosing knee pain. Short answer is don't do it. Doctors do that stuff. Don't look to the internet to diagnose what's going on with your knee. It's just not a smart move. I know it's like you Bill, the knee pain guru, and you're looking at alternative approaches, and absolutely, I think there are things that doctors are not absolutely qualified to do. However, there's some things that are absolutely in their wheelhouse, and that is diagnosing what's going on with your knee. So there's this component that you have to bring common sense to the table when dealing with what's going on with your knee. So as far as advice, suggestions, and tips on self-diagnosis, just don't do it. For instance, I got this, this was on my YouTube channel yesterday. Shelly said, I self-diagnosed myself with Baker cyst after my workout last night. When I got home, I looked everywhere for information on how to self-treat. There's a handful of it on YouTube regarding this, but you're by far the most thoroughly knowledgeable and take a holistic approach that I like. I will not go to the doctor. I'm going to try to treat as you directed. Not sure if you see this, but I have a question for you. In the middle of a 12-week bodybuilding challenge, I'm on week 7. Need to make adjustments on my training. Is it safe to do squats, deadlifts, etc.? Just ordered knee sleeves. Will that make a difference? Really appreciate your advice because I really appreciate your outlook on treatment. First of all, terms are hugely important here. I don't treat. I don't advise. I don't diagnose. Doctors do that. That's what they're good for. And go to a good orthopedic surgeon. Go find a local collegiate or professional sports organization and find who they send their athletes to and go see that guy or woman, their orthopedic surgeon, because you're going to get a real no-nonsense diagnosis of what's going on and how they would approach it. Then at that point, come talk to me. Then we'll talk. If something is broken or torn, or nothing is broken or torn, we can figure out a strategy, an integrated strategy. But, to self-diagnose yourself, you're reporting to the Department of Redundancy department on that one. Point being is, go to a doctor, get it checked out, so we rule out anything as being broken or torn. I'm saying this from my own perspective, my own personal experience. Because I dislocated my left knee 4 times. Like I needed the 2x4 in the middle of the forehead to get the fact that I needed to go to the doctor to know what I was dealing with. So this isn't, especially when you walk, how you stand, how you move. Your legs are so crucially important to who you are as a human being, as a man or a woman. Hugely important. And you can't mess around with that. Take it serious. Knees are no joke. You can't walk. You look like an old person. You move like an old person. It affects your health. It affects your attitude. It affects your mind. It affects your relationships. So there's so much that is involved in that. Go to a doctor. Get the knee checked out. After that, head over to my website, take the 7-day knee pain reduction challenge, get into one of my programs, whether it's, the ebook, the comfort zone, or one of my more advanced programs where we're working individually to help you get out of pain. But just don't mess around with this. It's not worth it. I suppose my life would have been completely different if I would have went to the doctor after the first knee dislocation. I probably could have avoided the 3 other knee dislocations and the surgery. So, this is something you don't want to mess around with. Welcome, everybody. If you have questions about your knees, knee pain, post them below. be happy to answer those for you. But I did want to address this piece on, advice, suggestions on tips on self-diagnosing knee pain. And that's one thing that's people get confused in coming to talk to me. They think I'm anti-doctor, and I'm not. If I have something that's broken or torn, I get into a car accident, I want a Western medical doctor taking care of me because they're going to fix the damage that has occurred from the accident, the injury, whatever is going on. But if I go and get a CT scan, an MRI, an X-ray, and the doctor is saying everything's normal, there's nothing wrong, here, take these pain pills and go home, or here's some physical therapy, go do that, or we'll give you an injection, a pain-killing shot, I don't want to have anything to do with the doctors at that point because they don't know my body like I know my body. And that's an important distinction, an important line to draw in terms of what's in your wheelhouse that you need to be responsible and take care of, and what is in a doctor's wheelhouse that you need to go to them for what they specialize in. So, have utmost respect for doctors that know their role. That's what I got. Thank you so much for being here. Type any comments, questions, suggestions below. Forward this to your friends who limp. And we'll see you in the next video. Thanks a lot. Have a good day.